So thank you. On the behalf, I would like to show my expectation to His Excellency, Dean and Deputy Head of Facility, Staff Management, Professor, Judges, and also another presenter and the audience who are participating here. My name is Rotana, a sophomore of medical doctor and a junior of Bachelor of English at International University. Today, I feel really excited to make a presentation about the malaria. Does anyone in here, have you ever heard about malaria? Thank you. Malaria is a kind of disease that usually appear on the children, especially for kids who are under 5 years old. It's caused by the protozoa infection, which is the parasite in the plasmodium are delivered by the female Anopheles mosquito. In every year, nearly 290 million people are infected with malaria, and also more than 400,000 people die from the disease. People who were experienced with the malaria after the mosquito injection within 10 to 14 days, they usually felt high fever and also the shaking chill. That is the first sign of malaria. In this first stage, patient also got any the symptoms such as the coughing, short of breath, or high blood pressure, also with the nausea or vomit or frequent urination, which is the result of parasite attack and destroy the red blood cell. Another stage of malaria is referred to the hot stage of malaria, that it's just about 2 hours before after the first stage, and it releases some symptoms such as the hot breath, also a foul mouth, a thirst, rapid pulse, a diarrhea, and also the restlessness that before to enter to the last stage. In the final stage of malaria, it's referred to the sweating stage of malaria, that it's appear approximately 1 hour after the hot stage of malaria. By the fever is begin to moderate, and also the body temperature rapidly drop, and the blood pressure also become to normal, that lead by the tiredness and also the falling asleep. So to find out the malaria, doctor need to collect of the information that related to the bitten of the mosquito, due to ask the patient about the history of traveling or camping to the mountainous forest, such as asking about where have you been before, or does anybody in your family have the malaria. So this is the note that in the diagnosis process of doctor need to know. And for the specific test that doctor can approve that this patient have the malaria is doing the blood test. During the blood test, it has many ways to find out that those patients have the malaria by doing the thin and thick blood smear, is the sensitive and specific test, which is show about the presence and also the type of parasite of malaria that caused to the patient. And also the complete blood count also used to describe how the white blood cell become to normal and the lower of the platelet. If the microscopic examination is not on hand, the doctor will do the rapid diagnostic test to release the fast result of the malaria. But however, it may be not as accurate as sending the sample to the lab, and also it may not detect to all type of malaria. So after the result of the malaria that approved by the lab, doctor will do the treatment by using the sum of medicine that related to the patient age and also the body weight. One is the age of the patient. So some type of malaria that are plasmodium Vivax, Plasmodium falciparum, Plasmodium ovale, and also the Plasmodium malaria are treated by two types of sensitive drug. For the first is the chloroquine and the second is the primaquine. Chloroquine is the well tolerated and it produces the pruritus, dark skin of the patient, and it also used in the treatment of acute malaria. Chloroquine may cause nausea and also the dysphoria, and it traditionally a 3-day course of treatment that uses the 25 milligram per kilogram of body weight, and then 10 milligram per kilogram at 24 hours and 5 milligram per kilogram at 48 hours. Primaquine also recommend use with the Plasmodium vivax and also the OR that it eradicates the form of the parasite that survive in the liver. And primaquine may cause nausea and also the abdominal pain if it's taken with empty stomach. So primaquine is also used with 0.8 milligram per bath in a kilogram of the body weight. In the adult dose is 45 milligram. To avoid from the malaria, you need to dress up with a long sleeve shirt and also the long pant, short, and the malaria coat. Sleeping inside the bassinet is the best choice, that especially for the net have been already deep into the insecticide solution that is the mosquito head. So by the mosquito, and also when you have a carelessness lifestyle, it's not hard to avoid or it's not hard to escaping from it, but if you have a really good lifestyle or also the clean and healthy lifestyle, you can be avoid from it. So that's all for my presentation, and I would like to say thank you to everyone for enjoying and for my presentation.